bag belongs to Rinky. Rinky doesn't need it anymore. She was thrown out of school when she got tuberculosis. This is TB, or tuberculosis, or TB as it's commonly known. Though fully curable, it's become a worldwide pandemic. There are 9 million new cases in the world each year. There are 1.3 million deaths annually. Before the day is over, 5,000 people would have died of TB. TB has created 10 million orphans. And TB is not just a disease. It's a socio-economic problem with millions losing jobs and productivity. It is estimated that the loss to the world's economy shall be an unbelievable $3.4 trillion in the next decade due to tuberculosis alone. And now the disease is back in a more deadly avatar, that of drug-resistant TB, where medicines don't act at all, and patients, they are doomed to die. It has been found that in the past 2 centuries, 1 billion people died of TB alone, and less than half the number died of all other pandemics combined: smallpox, cholera, the plague, HIV/AIDS. So TB is the biggest infectious disease killer in the world. And mind you, TB is curable. So why this sorry state of affairs? Why this horrifying scenario? When I started work in TB, I found that patients have to face many challenges. Treatment centers, which patients must visit daily or alternate day for full 6 months, they are situated far away. And they are open at inconvenient times during the day when people have to earn their living. So if the choice is between wages and food for the family on one hand, and TB treatment on the other hand, people choose to work. They continue to suffer and die. They continue to infect others. There is so much social stigma against TB that patients are frightened. They don't want people to know of their disease. They lose their jobs. They lose their homes. They're thrown out of school. There is no love, no care, no education, no awareness. My patients are living in absolute poverty, and TB further pushes them deeper into poverty and debt. And there is no follow-up of missing patients, which leads to the dreaded drug-resistant TB. So I thought to myself, let's take TB treatment to the doorsteps of the disadvantaged. Make treatment accessible. Operation ASHA centers are situated deep in disadvantaged areas, in temples, in homes, in shops. No one has to miss work and wages in order to get the medicine. Centers are open early morning and late night, so their privacy is maintained. For patients who live in far-off areas, we are doing mobile treatment. Operation ASHA's foot soldiers, they trudge long miles into difficult territory. They go on foot or they go on bikes. They go marching to meet up with their patients in far-off areas. In the Mekong Delta of Cambodia, my workers are going on boats from island to serve patients. But I also believe that all treatment should be given with love and compassion. There was a little girl, 11-year-old girl, in an orphanage, and when she got TB, the supervisor decided to throw her out in the streets of Delhi, and the girl would have died. Now, I was desperate that the child should be kept in the orphanage in the safe confines of the orphanage. But what could we do? The supervisor, she was adamant, she just wouldn't listen. It seemed that nothing would work. So finally, my colleagues and I, we threatened that lady. We said, we'll complain to the higher authorities. We'll see to it that you lose your job. And believe me, that worked. The little child, she stayed in the orphanage. Her treatment is completed. She's well and happy now. But this is the chilling truth. TB patients have to face horrifying violations of human rights in their day-to-day lives. Now coming to technology. Technology can be a powerful solution for health issues. E-compliance is simply a very low-cost device, a tablet with a fingerprint reader attached to it. Now, these devices are kept in the treatment centers where patients come and take the medicine. Patients give their fingerprint on every visit. If the fingerprint is not there, immediately an alert goes to the health worker who has to go to the patient's house, repeat the education, give the medicine, take a fingerprint as proof of visit, and retrieve the patient. Bring the patient back into the system. This ensures that every dose is taken. This prevents drug-resistant TB. The World Bank's India Development Marketplace played a crucial role in scaling e-compliance across India. And not only that, they helped us upgrade it to a zero-text application, and that is now being used by totally illiterate health workers across the globe with perfect ease and with accuracy. Yes, we've succeeded in scaling up. We've gone beyond the borders, we've gone beyond the oceans, but there have been so many challenges in the past. Initially, when I started work, there was no awareness about TB. Everyone said TB had been eradicated, so there were no funds. And at a personal level, I received a lot of criticism from others for having chosen the road less traveled. I had to endure a lot of hatred. I had to endure the jeers of the multitudes. And at the same time, Operation ASHA was not welcome in the TB arena at all, in the TB scenario. There was a lot of resistance from the other NGOs. And I wondered why. And then I realized the reason is that I wanted my organization to be cost-effective. I believe that results matter. I believe that outcome has to be measured. Impact and outcomes are the most important thing. And the resentment continues to this day, but it doesn't matter one jot. In the interest of the patients, work goes on with full dedication. Many factors helped me in the scaling up. And one of them was the low cost. Operation ASHA has a low-cost, replicable model. So we can take it to any part of the world with perfect ease. Our cost of detecting and treating one TB patient is only $80, which is several times less than all other organizations. The technology, too, is cost-effective. And it is so simple, it can be upgraded to suit any geography, any language, any terrain, any country. We can take the technology anywhere and do just a simple 2-hour training by Skype. And yes, the work can be done in any remote part of the world. The technology can also be upgraded to include any disease that is required, that needs regular monitoring and continuous follow-up of the patients. We work with local governments. We work extensively with disadvantaged local communities. We create jobs for these people. We train them in TB and health issues, and that's how the work goes on. We started with one TB treatment center in 2006. Now, Operation ASHA is serving 6 million people in 9 states of India. Our work has been done. It's been carried over to another country. In Cambodia, we are serving 10% of all patients, and very soon we'll be doing 25% of the entire country's TB work. Our work has been replicated in Uganda, in Kenya, in the Dominican Republic, and discussions are going on in so many other countries. And that is because tuberculosis is spreading. The disease is spreading like wildfire. The disease has staged a comeback in those countries from where it had been completely eradicated, from the West, from UK, from US. So this, in a nutshell, is the story of tuberculosis. TB is no longer an ancient problem. It's a contemporary disaster. Let us see the writing on the wall. Unless we act now, TB will be the new plague that can wipe out millions from the face of this earth. And this is a war we are fighting, a war against disease and poverty. We have to allocate funds, we have to dedicate resources to fight this war. Each person who's listening to me, every single one is important. Together, we can make a difference. Together we shall eliminate tuberculosis. With your support, the fight goes on. And Rinki is back to school again. Thank you.